Now, the tragic story of 3-year-old Isabel Pippi Kruger captured the hearts of people across the world when, after a tragic accident at home, she sustained severe burns to 80% of her body. Now, Pippi did subsequently undergo surgery that saw her receive a cloned skin grown from her own stem cells, and she's currently recovering. Now, it's medical technology like this and other advancements such as Scar FX that will be discussed by medical professionals at this weekend's Cosmedica conference in Cape Town. And here to chat to us about that, we're joined by aesthetic physician Dr. Anushka Reddy and plastic surgeon Dr. Matteo Clementoni, who will be attending the conference. Good morning to both of you. Great to have you here.
Good morning. Good morning.
Now, Dr. Anushka, I'll start off with you. Just give us a bit of a background on exactly what the Cosmedica conference will be all about.
It's the first time that we are hosting an international faculty in Cape Town, and we're very excited about it. And it certainly won't be the last time, I can tell you that much. So what we've done is that we've got a group of doctors from all over the world to discuss the latest trends and techniques in aesthetic medicine. And it's going to be hosted this weekend at the Vineyard. And so if you're a plastic surgeon or dermatologist or aesthetic doctor with an interest, in either lasers or Botox or fillers, then, that's what we're all about.
Yeah. Now, Dr. Matteo, like I said in the beginning, one of the things that will be discussed at the conference is Scar FX, a new treatment, brand new treatment. What exactly does it all entail?
Scar means synergistic coagulation and ablation for advanced resurfacing. Is a new technique developed in the US together with some European doctors to treat severe burn scars as the young girl unfortunately received. We create hundreds of very deep holes inside the scar, and this change the features of the scar tissue. We have many tools, surgical tools, as flaps or skin expanders to solve this scar. But unfortunately, there are many situations where the traditional approach are not available. So now we have this new CO2 laser that can create very deep hole. And then we have biochemical and biological modification of the tissue. And the functional and aesthetic improvement are really unbelievable.
Wow. So the machine works, as you just explained now, by creating holes in the skin, and that's helping it to recover, if I'm understanding correctly.
Yeah, the secret are not only the hole, are the heat generated by the device. Yes. The heat activates some proteins called heat shock proteins. And you have to imagine these proteins like a driver that can guide the skin more towards a normal healing than towards scarred healing. So I think that this is the real secret.
Yeah. Now, we were talking a bit about the history of this technology and how it came about. You said it comes from the US military, that it was developed for soldiers, right?
Yeah, there are two centers in US, one in Miami of Jill Weibel, is a civilian doctor, and the other, the most important one, is San Diego, in the naval base, the Navy base of San Diego. And unfortunately, they have many warriors coming back from the war zone, from the war countries. And I saw there some Marines with terrible scars for the explosion of bomb. And Dr. Yubel Hoer there is the chief of the dermatologic department, treated them, and I saw real very nice results. I remember one Marine that was not able to move his hand before the treatment, and after 3 treatments, now he's able to take a glass and to drink water. Wow. So can you imagine not only the aesthetic things, but also the functional and the everyday life? Yeah. I think that's very important.
And so you say that the reception that you've gotten from people that have received the treatment in general has been very, very positive indeed.
Yeah, but there's another very nice story to tell you. There's one of your colleagues called Katie Piper in London. Unfortunately, she was born by her ex-boyfriend, jealous boyfriend, that threw on her face some sulfuric acid. Wow. Unbelievable. In 2008. She went to the Westminster Hospital. She received more than 30 surgeries all around the world, Turkey, US, Asia, Europe. But unfortunately, she lost her left eyes, and she has terrible contracted scar on her neck. And I saw Katie 2 years ago, and I did 4 surgeries on her. And now I received a very nice text from her BlackBerry saying me, "Oh, thank you, Matteo, you have the capability to give me back my face."
Wow.
So I think that this is not a thing that can substitute traditional surgical approach, but it's a new thing that can help us to obtain very good results.
Yeah. Well, we've got some pictures, some footage of some of the before and afters of the results, and I mean, you can see the dramatic change in that. Obviously, so let's just take a look at that. About how long after the first couple of treatments is that?
Here
so this is after one treatment,
yeah,
it says there.
It's
Yeah.
only after one treatment, 3 weeks later. This guy was not able to move back his head before, and I did only one treatment on full neck and the face, and now she can move better back the head. So it's absolutely better after the treatment, only after 3 weeks.
Look at this one over here. What can you tell us about this one?
This is one of the very famous patients. It's not my patient. It's a patient coming from US, and here you can better appreciate the static improvement from before and after. And you know, this is more for aesthetic.
Yes.
It's less functional. This is another terrible burn of the back, and before and after. You know, the relaxation of the skin is unbelievable.
Wow, that's amazing, amazing results. And so, Dr. Anusha, just quickly, how far are we as South Africa in terms of the development? Are we catching up? Are we on par with the world?
Yes, absolutely. We're there already.
Yes.
You know, we've got the machine it's going to debut at Cosmedica, and we're there. So yes, it's going to be available very soon, from what I believe.
Yeah, it's already.
It's in South Africa. It's just a matter of training the doctors now.
Lovely
so we're good
stuff.
to
Well,
go.
thank you very much to both of you for coming in this
Pleasure.
morning, and good luck with the conference this weekend.
Thank you very much.
And as I was challenged just before we started by Dr. Anushka to say synergistic coagulation and ablation for advanced resurfacing. That's what SCARF FX stands for. Really, really, really great. Now, it's amazing times that we live in, and for more information, you can visit our website, expressoshow.com. Now, stay tuned, because after the break, we have an appointment with our vet, Dr. Roy Aronson, talking all about pet health. So if you have any questions on the topic, give us a call on 083 9133 728. We'll be right back.